Okay, so now I'm going to talk about what it's like at university and the kind of things that you can expect. So in your first year, you are expected to get 40% or above, and that's considered a pass. And your modules include something called Introduction to Nursing Practice and Decision Making, and this involves taking an exam which is called an OSCE, and there you have to practice your basic skills that are essential in nursing care. So you will have an assessor and you will have a patient, and you will be expected to take their pulse, take their respiration rates, take their blood pressure and take their temperature. And alongside this as well, you will be marked on professional, how you communicate with the person, so your professional techniques and values, and also infection control. The way that it's marked is so that all the main criteria is given a 2 grade, and all the less criteria is given a 1 grade. So if, for instance, you forgot to do something which was part of the main criteria, which is a 2 grade, you would have failed your OSCE, because you have to get all the 2 grades throughout. I found it quite nerve-wracking. You do get a lot of support and practice before you actually do your OSCE. There's a place called Space in the university where you can go and practice your clinical skills, and you can go with your friends, or you can go alone, you can practice on a tutor. There's always a tutor in the room, so they'll be able to help you out if you get stuck. And then, like in lessons, you cover things like injection technique as well, medication administration and medicine management. You also look at giving somebody a bed bath, cleaning their teeth, which is something that in LD can be quite difficult sometimes, especially with people with profound and multiple learning disabilities, when they're unable to open their mouth or they have a bit of anxiety about brushing their teeth. Also, you learn about how to clean a wound, using an aseptic technique, and you also are taught how to make a bed, how you would make it in a hospital, and to prevent pressure sores occurring, and also you are taught how to make a bed when somebody is lying in it as well, which can be quite difficult, but it's quite easy once you get the hang of it. Part of the Introduction to Nursing Practice and Decision Making module is also that you have to take a patient handling session and a basic life support session before you can go on to any placement. So these are compulsory and they will have to be taken. So with your basic life support, you'll be looking at just giving people CPR, and also if somebody's choking. And that's just kind of for LD, mental health and adult nursing, that would be on a adult dummy, whereas children nursing is a little bit different. And the patient handling session looks at how to get people from sit to stand positions, how to get people out of bed, how to use hoist, which is a big area in learning disability, and it really kind of makes you more aware of your body stance and how a lot of us slouch and it's bad for our backs. You're also taught how to carry a load safely and securely without damaging your back, which I found quite difficult, and I'm still finding quite difficult sometimes, because I think I've got myself into a bit of a habit of doing certain things the way that I lift things, and I get told off for it, so it's not that good. Also, part of your Introduction to Nursing Practice and Decision Making module, you also look at physiology of the body. So you'll be looking at the cardiovascular system, respiratory system, digestive system, the renal system, the nervous system, which is a big area in learning disability nursing, skin and cells as well. And then finally you'll be looking at pharmacology, so that's a bit to do with medication. One book that I found quite useful when I was studying for my physiology, because you actually get marked for your physiology as well when you do your OSCE. So you have your OSCE, and then straight afterwards you have to go and take a short exam all about physiology. Quite a lot of people have got this book in the university as well. I got mine off Amazon. You can get 5% discount if you've got an NUS card from Amazon, so that's a little bit helpful. And it's called Ross and Wilson Anatomy and physiology in health and illness, and basically it's got everything that you need to know about the body whilst you're studying at BCU. And then in your first term, in the first year of university, you will also have another module alongside this as well, which is called Professional Values and Academic Skills. For this one, you're expected to write an assignment, which is 1,500 words, and this links to a poster presentation that you do as a group. So together you have to create a philosophy of what you believe is good nursing care, and then from that philosophy you have to choose one key area and then talk about this in your assignment. For me, I decided to focus on promoting independence in people with learning disabilities, and then you have to link it in the assignment to another field of nursing. It's part of an NMC requirement that you get an overview of what the other fields of nursing actually do. So I linked mine to children, because often children in hospitals, their parents often speak for them, and even though they might be able to speak for themselves, they're not given that opportunity. So I linked it to that. Also in that module you'll be looking at things like your code of conduct, so the NMC code of conduct, history of nursing, record keeping, just like a brief overview of that. You look more into that in the second year, which I'm doing now. Law, ethics and human rights, safeguarding, diversity, care and caring, about the mentally disordered female, and you also look at your e-portfolio as well, so you give support with that. My year was the first year of using the e-portfolio, so we were given more support in how to use that because it was brand new. And then also in your professional values module you will have to do a numeracy exam, and this in your first year is like 70% pass mark. You have to do it, you have to pass that in order to move, well, you have to pass everything to get on to the next year. If you do fail, you do get a second attempt at it though. When I first heard about that we had to do a numeracy exam, I was really fretting because I'd always been really, unconfident in maths when I was younger. So I started actually practicing my math skills more or less straight away as soon as I found out about it, and I think that gave me a good advantage over other people that maybe left it until a little bit later. I'm one of those people that don't like to rush things anyway. So yeah, I contacted the PDD, I went and sat with them and expressed my concerns, and they put me at ease. There's practice papers on the PDD Moodle site, so they're good to look at as well, and I was constantly practicing them. And also a book that I found quite useful, which really built my confidence up, and I was really happy when I got the answers right, was How to Master Nursing Calculations. I got this off Amazon as well. It's only about £5 and it includes everything that you need to know for the exam and in the first year, and also in your second and third years as well. Just be aware as well that your numeracy exam pass mark will go up every year. So for me, in my second year now, we have to get 80%, and then in final year you have to get 90%. And obviously we have to be good at numeracy because it has to link into ideal calculations, so we don't overdose somebody or not give them the exact dose of medication that they require. The numeracy exam includes topics such as addition, subtraction, long multiplication, long division, simplifying a fraction, finding percentage of a number, and multiplying fractions as well. And then you also look at, in your second semester of university, you start your field-specific module, which is called Nursing Practice 1 in Learning Disability Nursing. This is one exam that you have to take, and the exam you choose 4 questions from a list of about, we had 13 to choose from. So you then focus on revising on the topics that those questions cover. So the topics that are included in the module are normalisation and social role valorisation, which is a concept that's often used in working with people with learning disabilities today. So they're treated equally the same as other people in the community, they're not hidden away in institutions. It's about not wanting to make them normal, but giving them a normal more of a normal lifestyle and promoting independence and decision making more like any other person is deemed to be able to do. We also look at the ages of learning disability, concepts of disability, social inclusion of people with learning disabilities, causes of learning disability, what it means to have a learning disability, therapeutic approaches in learning disability nursing, the media perception of people with learning disabilities and also just people who are disabled in general, safeguarding issues, challenges ahead for the learning disability nurse, palliative care in learning disability nursing, mental health and forensic care, working with people with learning disabilities, healthcare in general with people with learning disabilities. This has been a big area in the last couple of years with people with learning disabilities, as they've not always been given the same access to healthcare as everybody else, and often if you look at death by indifference and also 74 deaths and counting, which is by MemCap, they look at some cases of people with learning disabilities who've died unnecessarily in hospital by just being not given their basic needs, like not being given anything to drink, or not being fed properly, and it's often down to just communication, because the doctors and nurses in general hospitals don't always know how to communicate the best for people with learning disabilities. And then we look at hate and hate crime, and this links to a presentation that we had. It was a really, really good day, and some service users came along as well, and we looked at hate and hate crime in Birmingham and the whole of England and how it's affecting people with learning disabilities and how widespread it actually is. We got a certificate for that, attendance of that, so that's good to put in your portfolio. And then challenging behaviour with people with learning disabilities, and also person-centred care and person-centred planning. And then your final module of the year will be something called Health and Society. This is an assignment, it's 2,000 words long, maximum, and you choose a health issue from a range of topics that are covered in the lessons. So this could be obesity, smoking, drugs, sexual health, alcohol, epilepsy. There's loads to choose from. I chose to do obesity because I thought I want to keep it simple, I don't want to overcomplicate things. With this assignment, you don't look at your own field of nursing, you look at the other fields of nursing and how the nurses in that then field would approach somebody who, in my case, looking at an individual who's obese. Topics included in this module include health inequities and inequalities, equality and diversity, drug misuse, issues of smoking, the ageing process, epilepsy, health policies and the importance of nutrition. At the end of the year, you're expected to do something called CAP, which is kind of just like going over the areas that you've covered in the year, anything that you want to improve upon, if you've got to retake anything to do it during CAP. And then you're also given like mini topics to cover. You have a booklet that you have to fill out in learning disability nursing. You're looking at the nursing process.